So could we start by you introducing yourself, just saying your name, your college membership status, and where you work?
I'm Ryan Devlin. I'm a student member of the Royal College of Physicians, Edinburgh. I'm a medical student at the University of Edinburgh.
Thank you. So could you describe how the coronavirus pandemic has affected your studies?
So they have been very disruptive to my studies. Whilst a lot of teaching would be in person, face to face, a lot of that has been driven online, and every interaction that we have that isn't outside of our bedroom has to be risk assessed, monitored. So studying has become very much limited to where you live, rather than going from place to place and interacting with people.
Thank you. So as part of your studies or your placements or any clinical work you're doing, do you use PPE? And have you experienced any shortages of PPE or similar equipment?
So currently I'm working at studying on placement at a research laboratory. But those don't use PPE aside from a mask. But the guidance on the government guidance on research laboratories is slightly different to on the ward.
Thank you. So do you have any thoughts on what the long-term health implications of the pandemic will be? I realize that's an enormous question, but if you have, do you have any thoughts?
It is an enormous question, and the long-term health impact, personally or just in society?
In society generally.
In society. So I do a lot of engagement with oncology and cancer research, and already we're seeing quite a challenge in terms of people engaging with the oncology pathway. So people not being diagnosed as early. So a lot of diagnoses, particularly for quite difficult or cancers with limited presentations, they can often be diagnosed in A&E. So people are not going to A&E as much, therefore diagnoses aren't going as much. People are putting off going to their GP and engaging with medical professionals because of that risk of both COVID, but also their risk to other people. But there's also limits on the workforce on getting people from diagnosis to treatment and aftercare. So even in oncology, there's this big risk of, after COVID, we're going to have another health crisis on our hands. And I imagine that's the same with a lot of patients and a lot of conditions. Aside from that, I think that the mental health consequences of isolation and COVID-19 are going to be quite drastic as well. For students in particular, I know quite a few who are, and this is even without isolating for 14 days, they're spending a lot of the pandemic on their own. So in flats that are meant for 5 or 6 people, they're on their own, and so they're spending a lot of time, they're spending the entire semester alone, which isn't healthy for anyone. So yeah, both in terms of the physical and mental health of a lot of people, there are going to be quite dangerous consequences.
Thank you very much. So in a similar sort of vein, do you think there'll be changes as a result of the COVID pandemic to the National Health Service, to the way that services are delivered, either kind of positively or negatively? Are there things that we can learn from what's happened?
I'm not sure how it's difficult trying to predict what will stay around and what won't. That's the thing. A lot of innovations will be a flash in the pan. They won't stay. But I suppose that we now have a wider and more comprehensive telecommunication network. So Zoom is now a lot better. You're able to contact your GP online. So I suppose that might stick around, although I'm not sure if it will. People find it reassuring to have a doctor in front of them diagnosing and telling them what's wrong, and there might be that disconnect online. So maybe that might stay around, maybe it won't. I suppose time will tell. Sorry, that isn't a very good answer, but it's the best one that I can give. I'm not sure.
It was an unfair question a little bit. So do you have any thoughts on the way that the government responded to the pandemic, either the UK government or the Scottish government?
So the UK government have been very reactive, unfortunately, with regards to the pandemic. And unfortunately, that's something that has been seen by a lot of organisational bodies, in part because the government's been reactive, so a lot of organisations have had to react quickly, but also in part a lack of proactivity in a lot of areas. So there have been a lot of opportunities for the government to respond better to the pandemic, in particular bungling the track and trace system, because that's what lockdown was meant for. Lockdown was never a permanent solution, and I don't think anyone was pretending otherwise. It was sort of a stay or a pause to allow the government to put in the infrastructure in place that would facilitate social distancing and that would facilitate comprehensive testing and protection for everyone. So the fact that that hasn't come into place is not a good reflection, and the fact that we need a second lockdown is not a good reflection on the government's response. Plus the fact that as a percentage of the population, we've got one of the worst death rates in the world is not a good reflection on the government's response.
Thank you. So in a similar sort of vein, do you have any comments on the public's response to the pandemic and the lockdown, in terms of things like complying with all these new regulations?
Whilst there have been some elements of frustration amongst people right now, I think that the public response to the lockdown has been incredibly admirable. So I remember seeing a statistic, I'm not entirely sure of the accuracy of it, but I think it's anything from 1 in 4 to 1 in 2 people have volunteered during the lockdown to support not only friends and family, but colleagues and people that they don't even know. So there has definitely been a community spirit that has been brought about by the pandemic, I feel. The members of the public have been very, very keen to help their neighbours, to help other people, be it through food banks, through being part of the NHS support call centres, checking up on people. That this has been the most heartwarming aspect, that public response, when so many various outlets, from films to news, have projected this idea that everyone will be tearing each other apart limb from limb. The complete opposite has been true.
Thank you very much. So I'm now going to ask you questions about the personal impact of COVID on you. And just a reminder that if there is anything that you don't want to answer, then feel free to just say it. So have you had, or do you know of any colleagues, friends, or family members, without giving people's names, who have personal experience of contracting coronavirus? And if you're comfortable, could you describe that?
I do have I know a colleague who they've been experiencing coronavirus, and that, from what I've heard, it has been quite distressing and tiring, particularly since they want to go out and help people. Unfortunately, aside from that, I haven't had any in-depth discussions with anyone who's had COVID.
Thank you. Could you describe how your home life routines have been impacted by coronavirus?
Yes, so the pandemic, the first lockdown started when I was in the middle of lab work. So it was a very stark impact, going from going to the lab every day to being stuck in one room. So home life certainly changed, from being able to go out every day to being stuck in one place, and being stuck in one place where the view wasn't very good, where the view became pretty much a computer screen. And unfortunately, because of having that computer screen, having it in your room, it became less of working from home and more, as a lot of people have found, what's the word? Living at work. That's the mindset that a lot of people had, because that screen was there. They weren't limited by office hours. They weren't limited by a commute. Work was there all the time. So certainly having that intrusion of work into your home life, and into my home life, was the biggest impact. And trying to get out of that mindset was very challenging.
So are you currently in private accommodation, or are you in halls of residence?
I'm in private accommodation.
So given everything you said about, your personal experiences and obviously your experiences as a medical student, do you think there's sufficient mental health support for medical practitioners and medical students? And do you think there's anything to be done in that area, especially during times of crisis like this?
Unfortunately, I didn't think there was sufficient mental health support to start off with, let alone with the pandemic. We, again, this goes back to the reactivity rather than proactivity, but we have a culture that requires people to self-report on quite a stigmatized be it condition or mindset. So there are still concerns with a lot of people that reporting mental health problems, poor mental health well-being will negatively impact careers, opportunities, and just the way that other people see you. So to have a culture in place where people have to then self-report and then ask for help when they're so terrified of the consequences, that's incredibly challenging and is something that needs to change, particularly since a lot of responses to poor mental health is to shut down, to become less active. So I do think there needs to be a shift in the culture to more proactively looking out for one another, making sure that people are all right, and especially during the pandemic. So making sure that everyone's connected, that everyone has sufficient access to the internet. So if Wi-Fi is particularly bad, providing dongles for people that have Wi-Fi, and ensuring that there is a community of medical students and doctors, and not just an individual who drifts into work and drifts past people.
Thank you very much. So this is my last question. I wanted to ask where you look for accurate information about the pandemic to keep yourself informed, and also whether you have any thoughts on the usefulness of social media and the internet to share kind of accurate and useful information to the public.
So whenever I look for information, or if I have a question related to the pandemic, then I'll go to the government website, government advice. I'll also, if I have, if it's a query related to the research, I might do a quick PubMed search if I'm to satiate my curiosity more than anything. With regards to social media, we need to get more attuned, same with the internet. So there's that analogy that if reading a book is like running a tap of information, then the internet, and by extension social media, is a tidal wave that washes over people and sucks you down. So I think in order to effectively use social media as an information collection tool, you need to be attuned to treading water on that ocean of information, and having the data skills necessary and critical thinking skills necessary to effectively disseminate information. And unfortunately, you also find that, so it's a bit of an oxymoron, that there's this wash of information, but it's also quite restrictive as well. So Google will personalize your search results. Social media will personalize what you see. So whilst you do have this wash of information, it's also tailored to you and what you search and what is most likely for people for you to click on. So yes, it's quite easy on social media to become sucked into an echo chamber. And sometimes that echo chamber can have the wrong information. So I'd say take anything that you see on social media with a pinch of salt. And that's saying it lightly.
Thank you very much. So before we wrap up, I just wanted to ask, is there anything else that you would like to say about coronavirus and the medical response to it, or anything you'd like to wrap up with at all?
I suppose that, yes, I want to reiterate that even though it's been an incredibly challenging time, difficult for many, a lot of people have suffered and lost loved ones. The response from most people has been absolutely phenomenal. People have shown the best of themselves during the pandemic. There have been some people, of course, who think that creating, I don't know, a fort out of toilet rolls is a good response to the pandemic by the rates that they disappear off the shelves. But most people have been incredibly supportive of one another, incredibly supportive of workers who work tirelessly throughout the year, but ever more so during the pandemic. So to everyone who has seen this as an opportunity to be the best people that they can be, yes, yeah, no, that's fantastic.